Hello everyone. So today, let us see what are the tests that one should get done for himself or herself. How do we diagnose someone with diabetes? Based on what? Blood test reports. To rule out diabetes, we should get ourselves done an 8-hour overnight fasting blood sugar test, 2 hours post breakfast, which we call as postprandial blood sugar test, done, and also a 3-month blood sugar average test, which we call as HbA1c or the glycosylated hemoglobin level, tested. So above what level do we say someone has diabetes? If the fasting blood sugar level is above 126 milligrams per dl, or the postprandial blood sugar is 200 or above, or if the 3-monthly average, the HbA1c level is above 6.4%, we diagnose a person with diabetes. What is this pre-diabetes? Many times we hear people say, I am a borderline diabetic. Only my fasting sugars are borderline. I have impaired fasting. What does that mean? We say someone has an impaired fasting glucose, that is only their fasting blood sugar is slightly abnormal if their fasting blood sugar level falls between 100 and 126 milligrams per deciliter, and if their postprandial blood sugar is between 140 and 199 milligrams per dl, or their HbA1c level is between 5.7 and 6.4%, we call these individuals as pre-diabetics, or those with borderline diabetes or impaired glucose tolerance. So what next? Any other test to be done? Yes. Diabetes is not only about blood sugar levels. It is a metabolic syndrome. I would rather call it a package. It doesn't come alone. It brings along with it hypertension, high cholesterol levels, which we call as dyslipidemia, and a variety of complications. So, what are the tests you should get yourself done? Most important, every time you visit your doctor, during your every clinic visit, please get your BP checked. Hypertension is a very common comorbidity or illness associated with diabetes. So please get your blood pressure tested and show it to your physician. Ask your physician whether it is normal or you need to get yourself treated or put under any medication for the same. Don't self-diagnose yourself. Please always ask your treating physician. Next, coming to the other blood tests which you can get yourself done. To rule out high cholesterol levels or abnormal cholesterol levels, which is also part and parcel of diabetes, please get yourself a fasting lipid profile, which will tell you any abnormality in the same. Then get your complete blood count, which will tell you whether you are anemic or your counts are abnormal. Get also yourself done a kidney function test, wherein you know your levels are normal. Also a urine routine done, which will tell you whether you have any urine infection or is there any protein or sugar leakage in the urine. So all these reports your physician can go through and guide you accordingly. As we all know, diabetes has a number of complications, which we call as microvascular and macrovascular in our medical terms. Among the very important macrovascular complications are cardiac complications. So to make sure your heart is fine, also get yourself an ECG done and associated along with that an echocardiogram or a treadmill test as per the advice of your physician. Please don't self-prescribe tests or medications. Always contact your care provider and go as per his or her advice. Diabetes can affect most of the organs in our body, starting with the eyes. It can have effects on our heart. It can affect our nerves. So wherein, the nerves of the peripheries, the hands and feet can be affected. It can affect the liver. It can have effects on our kidneys. It can affect our skin. So what do we do to find out whether we are developing any of these complications? What tests? Are there any tests to be done? Or are there any self-examination ways? How do we take care of ourselves? We shall see in the coming videos. Thank you.